Welcome. Today, we're talking about one concept that drives coding accuracy: consistency. How you document a diagnosis in your assessment and plan decides whether it gets coded. A condition mentioned only in passing may not make it into the final record. Over the next few minutes, we will walk through what consistent documentation looks like. Here is the core idea. A diagnosis documented sparingly may not be coded. If a condition appears once and then vanishes, the coder is left guessing. The discharge summary is the most important piece of documentation in the chart, as it summarizes the entire visit. Ensure your diagnoses are carried through to the discharge summary. Our first habit involves conditions that get better. When a condition has cleared up, don't just stop mentioning it. Explicitly document it as resolved. Writing the word resolved tells the coder the status is settled. The condition was real, it was treated, and it is now closed for this visit, removing all guesswork. Habit number 2, the VS conditions. These are the diagnoses you are actively working up, written as A versus B versus C. If these conditions are documented consistently and no final conclusion is reached, all of them get coded. Be aware that every diagnosis left on that list without resolution can end up in the coded record. A single letter, the D, changes everything. Rule in or rule out implies you are still deciding, which often triggers a query. Ruled in or ruled out implies a decision has been made. It is clear and final, sparing you the query. If you have reached a decision, always use the past tense, ruled. What about uncertain diagnoses? Suspect, probable, or likely conditions can be coded if they are assessed, managed, and consistently documented. For example, if a patient is treated for chest pain, and the provider notes the condition is resolved and differentials were ruled out, the final diagnosis can be captured accurately. Let's look at heart failure. In charts where the condition is documented consistently note after note, it is codable. If the diagnosis appears only once or twice and then vanishes, it likely won't be coded without a query. The same patient and same disease have different outcomes, based solely on how consistently you document them. The same principle applies to respiratory failure, adding the importance of specificity. When documented consistently from the emergency department through the discharge summary, and including resolution, it is codable. Consistency captures the diagnosis, and specificity ensures it is accurate. In a differential of myocarditis versus type 2 MI versus Takotsubo cardiomyopathy, if all three are carried as versus diagnoses consistently with no conclusion, all three will be coded. If you rule out 2 and narrow it down, only the final diagnosis is coded. Your words dictate what makes it into the final record. In summary, here are 5 habits. Be consistent, say resolved for cleared conditions, mind your VS lists, use past tense for decisions, and support your uncertain diagnoses. Document it once, document it everywhere, and let your words tell the complete story. Thank you.